Hello everyone, hope you all are doing well and utilizing Know Your Calling at your best. Today I'm extremely pleased to have Dr. Vishnu Kumar sir in front of us and we'll try to dig out as much as information from sir about the rheumatology part and we'll try to discuss all the details information about the residency part and we'll try to see the branch as a future also and we'll try to ask some difficult question from sir about the college selection also. So let me just introduce sir first. Sir has completed his MBBS from AIMS Delhi in 2011 and sir has completed his MD pediatric from AIMS Delhi, PGH India in 2019. Sir is currently doing DM rheumatology training in Jippa Medical College. So, sir, welcoming you all in this beautiful podcast, sir.
Thank you so much for introducing me and having me here. I love the name, first of all, Know Your Calling. It's something that is very difficult these days. And so that's what, encouraged me to have this talk also.
Yes, sir. Sir, so we try to have beautiful conversation for the rheumatology part. And sir, please introduce the basic information about the branch and life in the residency.
So I'm doing my DM training right now, rheumatology as a branch, or we call it immunology as well in many of our colleges. So it is basically a clinical branch which deals with diseases and also basic science as well. Like the basic science behind the cause of the diseases. So the basic science part is predominantly called immunology because the diseases which are called are caused are immune mediated. So these are immune mediated diseases predominantly affecting the soft tissues and also the joints and the bones of our body. Obviously, there is a lot of systemic component involved, and that is another charm of this branch that almost all of our organ systems can be involved in these diseases. So yeah, that is about rheumatology and also immunology, which as I said, is the somewhat of a basic science component of the branch.
Okay, sir. As you sir told about the introductory part about the branch, sir, I just excited to know about the residency part, how it will be going in the process.
Yeah, so currently in my in the junior residency, you can either do a normal MD medicine or, as like me, you can do a MD pediatrics before joining the DM residency, both of which are eligible. After joining the residency, compared to something like a maybe an interventional branch like cardiology, gastroenterology, this is not so much of an interventional branch. Although, yeah, patients do get sick again, depending on the hospital where you are working in. Patients can get sick, especially if you have an ICU, if you have a sick ward, etc. But predominantly, it's a non-interventional, elective-based branch, if I may say so. So yeah, it would come like if you're asking me about the hectic part of the work hours, it is not as hectic as maybe neurology or gastroenterology or cardiology. But yeah, it's not as light as maybe endocrinology also. But yeah, after residency, it gets somewhat light, if you can say.
Okay, sir. Sir, in this residency, are we getting the free time to do other stuffs and pursue our hobby in the future?
Depends on the college, primarily. If you ask me a one-word answer, I would say yes. But yeah, again, it depends on the college. Depend like some colleges have a very distributed, course. Like all your workload will be distributed throughout all your semesters or your 3 years. While some colleges might have a first year load based training. So it depends on the college. But overall, if you ask me, yeah, you can definitely pursue your hobbies, or you would get like a decent amount of free time, if not very free, in this branch.
Okay, sir. Okay. Sir, what things you love in the branch of the rheumatology? Can you elaborate more in this part?
So for me, it was slightly a weird one because I kind of love a lot of things about this branch. This might not be the case for me personally after my 12th or even after MBBS. I could not, kind of, as you say, find my calling or know my calling. But when it came to, kind of super specialty area, a lot of things about rheumatology. I'd like the multi-system aspect of it, the need for analysis in this branch. The involvement of bones and skin is something that really I like personally, because I always like the theory part of orthopedics, and also I like derma as well. So that is also there. If you ask me one thing, that would be the analytical or the diagnostic, challenge part of the branch that is there.
Yes, sir. Yes, sir. Actually, sir, this question I should not have been asked about this branch, but what is the cons of being in this specialty, you may say?
Cons, I think some people might want a more of a definitive treatment kind of branch. Our branch is something that has patients whose diseases are quite chronic. They don't get cured very easily. So control is obviously there. Patients do become asymptomatic while on therapy, but compared to something like a cardiology, or maybe even gastroenterology, that instant gratification thing doesn't come so easily. There's a lot of patients who have chronic diseases. They might become non-compliant, then they go into relapse. Some patients, even while being compliant on medication also, they might relapse. So that some people might find it tough to deal with. So majorly that is the con which I think I can say.
Yes, sir. Yes, sir. Sir, so being in this specialty, I hope you got the idea about you are. Is there any gender difference, or we can consider that type of personality should avoid this branch in the future to consider before choosing any?
Coming to personality wise, again, those people who like something like an intervention or something, a quick fix kind of thing, where they want the patient to become healthy, or they want the patient to do well without any further relapse or something. Those people might want to avoid this branch. And also those who would like this branch are those who really want diagnostic branches, and even maybe work life balance is a good pro of this branch. Yeah, and also coming to gender differences, like obviously the main gender difference part which one might consider while choosing a branch is the physically taxing part of it. Coming to rheumatology, there's nothing as such as physically taxing, or like taking a toll on you physically as such, or requiring a muscle power or something like that.
Yes.
So like something like maybe sometimes gastroenterology might need it, or maybe even cardiology in certain procedures, but not rheumatology. So rheumatology is, in fact, I think one of the most popular branches among both male and female genders. So yeah, it's quite a gender neutral branch.
Okay, sir. So, sir, every student will consider the branch accordingly in the interest of the every individuals. But sir, end of the day, question will arise like, what is the monetary benefits will get in the future? So, can you throw some light on this part?
Yeah, definitely. Like, yeah, again, I might have added this in the, cons part of it, that this branch might not be a very much lucrative branch, especially if somebody wants to earn very big money, because at the end of the day, big money essentially lies in the interventional branches.
Yes.
But yeah, definitely, if somebody wants to have a private practice quickly, wants to, somewhat earn more of in his 30s or something, and then kind of retire early or something. To be honest, there are very few branches in medicine in general which have that opportunity, but maybe in that aspect you can say Rumat is a bit better. uh, and also making your setup is a bit easy in this branch. You don't need a lot of instruments or something like that. You can just open a direct OPD, and even if at all you want to open a ward or a daycare for your infusions, for your biologicals, you can do that as well, with the help of certain pharmaceutical who can provide you biologicals. So, and also you need just a good monitoring setup. So you don't need a lot of
Yes.
extensive, stressful, or money oriented money having a lot of need for money kind of setup in this branch. And also when it comes to earning, I'm not really sure about it. Again, it primarily depends on where you settle down. Or maybe if
Exactly.
you're settling down in a tier two city or a tier three city where there's no rheumatologist, and obviously the patient load is increasing. There's no doubt about that. Primarily not because of maybe the prevalence, but because of the identification, because of the awareness which is ever increasing. So definitely the patient load is increasing, and if you go to a town or a tier two city where there are less rheumatologists, you can very well earn a lot. And if it comes to the cities, this is again one branch which is beneficially very still not saturated at all. There are cities with even super specialists like neurologists, cardiologists. There are even too many, if I can say, some cities. So this is not a branch like that. This is a branch which is still young. Still a lot of rheumatologists are still finding their place. There's a lot of empty space in most of the cities, so that is another advantage. If you want me to tell the numbers, maybe in cities I have heard of people earning like three around three at the start of like just post DM. But yeah, even I have to find out the details. I'm not exactly sure. It mainly depends on the city.
Yes, sir. And ठीक है, sir. So just I got the idea about the monetary aspect. Okay, sir. But individually, if anyone want to settle in the city, as you told about the tier two and tier three, but what is the difference between the government setup versus corporate sector? If any individual want to just stay in the job side.
Definitely. So rheumatology, even that way, being in government is quite easier being in the sense I'm talking about getting selected or finding a job. In the government setup is comparatively easier when compared to more popular or more kind of saturated branches like the original branches like cardiology, neurology, etc. Because still there are, like I just saw advertisement from AIMS Mangalagiri and stuff, still recruiting their first rheumatologists, right? So even new AIMS are recruiting their first batch of rheumatology faculty as such. So it's still quite young. If somebody wants to settle down, it's very good. Especially the research part is quite good because it's a branch which is new, and it has a lot of research potential, a lot of potential for identifying new things therapeutic wise as well as diagnostic wise. So yeah, that is really good too. When it comes to private, as I told you, the advantages are mainly not having saturation in the branch, and also easy setup. If somebody wants to set up easily, that is much easier. Like something, even an endocrine would be an easy option. Similarly, rheumat also is quite easy to have a setup. When it comes to your corporate, sometimes you might seem to earn less when compared to your hardcore interventional branches, especially when it comes to your late 40s or 50s. But yeah,
Yeah.
with every advantage there are disadvantages.
Sir, we will do a MBBS of 6 years and MD of 3 years, and after we'll particularize the branch in the super specialty rheumatology. और आगे भी सर उसके आगे any is there any way to any fellowship or any specialty training we will have to get to edge over other candidates in the market?
Fellowships, as they're not as well defined as well defined as in the Indian space. Like something like neurology, etc., have well defined fellowships in almost all, at least the main tertiary colleges. They have stroke fellowships, epilepsy fellowships, etc. In rheumatology, not so much yet. Obviously, they would be coming, and also there are a lot of fellowships outside India, in Canada, in Germany, depending on the disease where you want to specialize in. Again, it's not very open yet. Like you can't go to Canada and say you have a buffet of fellowships in all the diseases. It's not like that. Suppose you want to specialize in SLE, you might have options, good options in maybe Europe. If you want to specialize in spondyloarthropathy, maybe good options in North America. It's still somewhat scattered. But yeah, there are definitely options, and obviously there are a lot of options like doing a musculoskeletal ultrasound, these radiology based, or it's at the end of the day, it's quite a multi-system branch. So you can do those kind of fellowships as well, maybe in something like nephrology related fellowship, etc. You can definitely do.
Okay, sir. Okay, sir. Sir, got it. The idea about the thing you just told. Sir, I have one question about the future growth of the branch in the India versus the out country. If any student want to just go.
So I know of a few people who have gone to the Middle East, UAE, and Dubai after doing their DM. Uh, Again, it depends on a variety of factors. That is one place where you can earn good money, but again, your maybe research potential, or if you want to come back and do a maybe faculty job or something, that is kind of disadvantageous. Or and also, if you want to go to the US, unless you just want to do a fellowship and come back, that is possible. But if you really want to go and practice there, then you will have to do your MD again, actually. uh, Recently, India got approved to allow students to go to Australia, Canada, US, and I think New Zealand as well. But all these places, you will have to do your MD, and then you'll have to do your 2 year or 3 year kind of super specialization there in rheumatology. So it's not easy if you want to go to US or UK to pursue a life there, but you can definitely go there and do a fellowship. And if you want to actually settle down, then maybe Middle East are good options.
Okay, sir. As a being specialist in the branch of DM rheumatology, sir, how you see the branch after 10 years, 10 to 20 years down the line?
10 years down the line, it's definitely upcoming, mainly because something like endocrinology, right? Endocrinology is kind of in its peak right now, because there's a lot of awareness among patients, and also there are good decent like not too many endocrinologists, not too less. So it's still that fertile ground is there for endocrinology, mainly because the awareness is reaching its peak, and the number of endocrinologists are not too high. So I personally feel Romat will reach that kind of a stage where, to be honest, the awareness has still to improve right now. The patients which come to rheumatologists still come slightly late when compared to, suppose, something like heart disease or something. As soon as somebody finds like there's an issue with the heart, they directly go to a cardiologist. But when
Yes.
you compare that to a rheumatologist, the patient might go to an orthopedician, might go to a dermatologist, might go to a general medicine person. Sometimes there might be neural issues related to immunological disease. So he might first be seen by a neurologist. So there's a lot of still refining going on in that aspect, still a lot of awareness yet to be created in that aspect. But I'm pretty confident that will come soon, because obviously awareness is rising, and also the know-how among physicians also is increasing about rheumatology diseases. So I'm confident about that aspect.
Okay, sir. Okay. Sir, any individual who has just completed MD medicine and DNB medicine, so how a particular
And
individual,
MD pediatrics as well, like me, who
yes,
can, yeah.
yes. And how to choose a particular case, college or institute, what points to be considered before choosing and what things to be aware about to choosing any particular college to be a good specialist.
Uh, Fortunately or unfortunately, I don't know, it depends. But we have kind of not many colleges teaching or helping us train us in rheumatology for now. We have only around 8 colleges in government, and around, I think, 12, or maybe 15 colleges in your with your DNB courses, and I think around 4 or 5 private colleges. So that's around about 100 rheumatology seats and around 20 colleges only. So
Okay.
it's somewhat quite easy to maybe take a decision. Ionize obviously would be your best bet. Ionize as in mainly for now it is PGI and JIPMER, and AIMS Rishikesh also has certain seats in that. Mainly because of the absence of bond. Because
Yes.
even if, for instance, SGPGI is an unbelievable institute for rheumatology, but again, it has a bond of 2 years. So basically, you're doing a course of 5 years of rheumatology, 5 years of DM there.
Yes.
Obviously, if somebody wants to continue in government service, it's an excellent option because your experience keeps increasing, so it's well and good. But somebody wanting to go into private or have his own setup or do anything for that matter, just practice medicine maybe. If somebody wants that, then first choice would be your INIs because training is good, and also there's no bond. Personally, I would say bond is among the biggest factor, especially in at this age more so. Not just in MD also. I would feel bond is a big factor, but in your DM it increases even more the importance. So that is one thing. And among government colleges, you can actually, I feel DNBs are excellent. DNBs as well as DMs both are good. DNB mainly because there's no bond, and DMs are good as well because of it's good training, more academic exposure, etc. There are not many colleges. There are, I can just name them, like PGI Jipmar are among the INIs along with AIMS Rishikesh. Then there's SGPJ Lucknow, KGMU Lucknow, Madras Medical College, CMC Vellore, NIMS Hyderabad, and IPGMER in Kolkata. So these are the main government colleges that are there, and DNBs are also good.
Okay. Sir, we'll try to add on the list and the sources you have just told. We'll try to add on all the details in the description box so all the students
Definitely.
can get benefited from this institute. And actually, sir, you just told about the bond detail. Before choosing the CIP, I just considered that the bond will be a difficult part to consider after MD. So it is just a cumbersome process to complete in the way.
Definitely.
Sir, and the last and final question before concluding this session, is there any particular message, special message you want to drop to a student who want to think about the rheumatology as a super specialty branch to consider in the future side?
Special message would be it's a good branch if you're thinking about this. I think already you have that, kind of more of a general medicine analytical diagnostic bent of mind. So personally, I did not feel disappointed yet in my training till now that that aspect was actually like how I expected it to be. It's
Yes,
not like we are kind of, sometimes what happens is in the book we might find something very puzzle like and challenging, while in the actual practice you might find that it's kind of almost doing it on a spinal level very boring. But personally, I did not feel it that way. If you are really looking for diagnostic challenges, etc., it's actually a very good choice. Yeah, so you can, with that aspect, you can definitely consider it. I would encourage you to consider that.
okay, sir. Thank you, sir, for your message. And sir, many of our viewers watching and preparing for our NEET PG examinations and INE sets. So, is there any particular tips you want to share with our future doctors who just want to begin the journey of the MS or MD?
If you're asking me about the entrance exam, I usually find only students doing one mistake, that they are just aiming a bit too high. They're aiming to read a lot more than they might, especially if the person hasn't read as much in his MBBS. If he has read a lot in his MBBS, then, or MD for that matter, if his
Yes,
basics are very, very strong, then obviously you can go all out as you like, read your standard books, what guidebooks, whatever. But most of the time, what I have seen, and I myself have been through a slight small phase where I kind of overread things. So mainly, I see only this mistake, that people are reading more than they're supposed to, kind of. Uh, I wouldn't delve so much because I've kind of come out of that MD exit exam phase. But yeah, that's what I feel.
I hope, sir, many of our viewers get all the idea about the particular branch from this interview, and hopefully all the doubts will be clear by this interview. Sir, thank you so much for your valuable time, and it was a great pleasure to have one-to-one conversation with you. It was a great to meet you, sir.
Thank you. Same here.
Thank you so much, sir. Sir,